I am Dr. Subarna Acharya from EMS Bhubaneswar, and the topic of presentation is understanding the link between diabetes and GERD. And I shall be talking about this topic, how it is related, diabetes and GERD is related. And in short, I would like to give information about my patient and how should we prevent this disease and how should we prevent the diabetes. Generally, the diabetes is always celebrated every yearly in 14th November. It has gone, the date has gone, but I am teaching this topic to my patient about how should we prevent diabetes and how should we prevent GRD and by controlling the diabetes. And first of all, we have to know about what is diabetes. Diabetes means there is partial reduction or partial production of insulin or complete absence of production of insulin in the body. So insulin is mainly produced from the pancreas, from the beta cell that mainly used for uh, absorption of glucose in the body from the blood. So whatever we eat is absorbed or metabolized by the liver into the glucose, fat, and protein and get stored. So for proper utilization of the glucose, mainly the glucose particle, the insulin is required. So mainly in adult, there is partial loss of the beta function of the pancreas. That is, insulin deficiency is there. So that may cause diabetes. And so how it is related to GRD? GRD is a terminology that is known as gastroesophageal reflux. Mainly, many of the patients visit in our OPD with these symptoms like bloating, heartburn, abdominal discomfort, and patients are generally treated with acid peptic disorder. So the difference, there is a slight difference between the acid peptic disorder and the GRD. GRD is a reflux disease. It means whatever the content that we eat that get stayed in the our stomach for 2 to 3 hours. So before absorption or going passing into the intestine, it may come above the sphincter, that is the lower esophageal sphincter, that may cause the burning sensation because mainly acids are produced in the body. So why does it happen in the diabetes? Because in diabetes is mainly affecting the nerves. It can affect the blood vessels, it can affect the heart, it can affect the lungs, eyes. Every organ is affected by the diabetes. But now I am talking with only about the digestive system. In the digestive system, mainly the stomach. In stomach, the nerves are affected, blood vessels are affected, absorption is affected, and there is a delayed emptying of the stomach, that is known as gastroparesis, slowing of the gastroparesis, that is known as diabetic gastroparesis. Diabetes, if it is uncontrolled, it can affect the nerves, it can affect the slowing or the slow emptying of the stomach. So the gastric container remain in the stomach, so it can get refluxed up in the esophagus. So the lower part of the esophageal sphincter also get relaxed because of the diabetes. So diabetes should be controlled. Because of these factors, uh, lower esophageal sphincter get relaxed, stomach emptying get delayed, nerves get affected. So all these promotes the reflux of the content that what we eat, and it goes into the stomach, that is around the chest. In middle of the chest, the patient may feel discomfort. Patient may complain of heartburn. Patient may complain of bloating sensation and epigastric discomfort. So all these features combines the GRD. So the prevalence of GRD is more. Diabetes is mostly prevalent in our country, India. Around 101 million people are yearly diagnosed with the new diabetes, and pre-diabetes is diagnosed around 136 million people. So there is a lot of people suffering from diabetes and a lot of people coming with these symptoms and uncontrolled diabetes, not taking medicine, that may lead to the simple gastritis like symptoms, and that may get confused with the APD, that is acid peptic disorder. It is a component of APD, but it is a moderate form. It is not a mildest form. So we have to treat this accordingly. So not only taking the PPIs or medicine, we have to control these things by controlling the diabetes. First, prevention is better than cure. Prevention should be done. Weight reduction should be done. Weight reduction can also decrease the GRD because when there is obesity develops, it can cause increased pressure in the abdomen that compress the stomach, that again lead to the esophageal reflux that leads to the GRD. So prevention is better than cure. First, we prevent the disease by decreasing the weight. taking proper diets, taking more vegetables, early morning exercise, at least brisk exercise for 30 minutes, then this can prevent diabetes or pre-diabetes. If we prevent diabetes or uh, pre-diabetes, all other disease can be prevented. First, prevent it. Second, if already it happens, we try to control the sugars. We should always control the sugar strictly. SB1 should be less than 6.5. If the patient is taking insulin or in oral hypoglycemic drug, it should be less than 7. So pre-diabetic means SB1C more than 5.5 to 6.5. In between, that is known as pre-diabetic. So they can also decrease the sugar level by exercise or preventive methods. So first, we prevent the disease, treat the disease, control the diabetes, so we can prevent the other thing. Thank you.